name is Aput Stella Eunice. I work as a hospital administrator at Ngora Kwidaha Hospital, Church of Uganda Hospital, and I started work here in 2017 April up to date. And I'm here with Matthias. Matthias is from Link, Solar Link International, and who has been working with us for about 3-4 days now, connecting power into some of the points in the hospital. We want to appreciate Filda in particular and the entire Link, Solar Link initiative for the support that you have given us as a facility. You know, we are in a region where the power is very, very unstable, and most of the times we do without power. Sometimes power goes off and takes like even 2 days, and yet hospital work requires a lot of power all the time. First of all, for lighting, and also for the machines that are supposed to be used, that have always been used in the hospital. And oftentimes we've had trouble, especially in the nights when the power goes off. And most of the times our nurses have been using just torches, using their phones to torch when they are doing treatment in the night. And that has been very, very difficult and very, very uncomfortable for them to work, and they kept complaining about it. And we had a generator, but a generator could not power the entire hospital because it is small in capacity, and we could not run the entire hospital. So, but with the support of Link, Solar Link initiative, and specifically with the idea which was initiated by Filda, we want to appreciate you so much for the support. We have gotten like 4 units of solar systems. One of it has been installed in the maternity and the labor suite, and the mothers will be able, the midwives are going to be doing their work comfortably because there will be enough light when they are delivering mothers, when they are supporting the mothers, even in the labor suite, even when they are monitoring mothers, this other side of the maternity. And then the other system has been installed in the children's ward, and the children's ward is one of the departments, one of the wards here which is always congested, has many children. And you know, it is very difficult to identify, to get a vein from a child if you do not have enough power, enough lighting. And it has been a very big problem, and but with this initiative, this power, we are going to be comfortably working and taking care of the treatment of the children comfortably, looking for the veins without taking them through a lot of pain where the nurses keep on looking for changing positions as they're looking for the veins because the light has not been enough. So then the other unit is a general ward. We also have received the power. And for the other 2 units, we have power inside and also for the security lights, which has been a problem to us. So general ward, we have also installed. The Matthias and Julius have been able to work, and they are working. They have worked tirelessly for these days, and we want to appreciate them for the work since they came. They also installed in general ward that same system, like I said, lights inside and lights outside. But of course, then the other area is in OPD, and in OPD we have emergency or casualty department area where we normally receive patients from. And you know, patients come at any time, even at night, and sometimes it has been really very, very difficult for the emergencies. Some of them, they do the suturing of if they had accidents, they do the suturing, they do even the pricking, but it has been very difficult. Like I said, all of them have been using just their phones for doing this. And the accuracy of the work has been also wanting, although they have been struggling to make sure that they do it. So with this support, we are really very grateful, and staff are going to be doing their work very, very well in terms of treatment and in terms of maybe suturing for those who had any accidents if they had. And the only current challenge that we have is, of course, we've received the other. We appreciate the support, but we want to pray that maybe with time in the future, if we can be able to get even for the sockets, because we have oxygen concentrators, and we normally get patients who are supposed to be oxygen maybe even for 24 hours. And oxygen concentrators work with power. When there is power off, then there is no oxygen concentrator that can perform. And that has also been difficult for us, but it's just an area of prayer. Once more, I want to thank Matthias and Julius for the work, and I want to thank Fielder. I know that one time we are going to meet, but I appreciate the work that you've done, the donation that you've given unto us. And I know that when we meet, I'm going to pray that God will give us time that we shall be meeting together, and you'll be able to see the fruits of your labors here in Mora Hospital. May God bless all of you. Amen.
Thank you, all our friends from Solar Link Initiative and Mrs. Frida. We appreciate you so much with all the information you got from the Freda Car Hospital, Freda Ngora, Freda Car Hospital. She's the administrator here, and with all that information you've got, we appreciate, and we're also happy to be here. These people have taken good care of us. They've been feeding us, and they've been taking much care of us. So we appreciate them. Appreciate the administrator. We appreciate Dr. Oditi Amos, whom we've been so much in touch. We appreciate everyone and the administration of